Welcome to the Setiba Medical Spa podcast. Setiba Medical Spa offers aesthetic and wellness services located in Westlake Village, California. We offer state-of-the-art treatments which are administered by our professional team of highly experienced and licensed practitioners.
Hi everyone, this is Emilia, CEO and founder of Setiba Medical Spa. Welcome to another episode of Aesthetics and Cosmetic Show that we have. And today we have our medical director, Dr. Michael Gedder. Welcome.
Thank you, Amelia. It is a pleasure to be here. And Setiba, we do a great job on how people's appearance can be altered and enhanced with all the modern equipment and
Correct.
techniques, as well as well-trained providers. But when we take care of our outside appearance, we have to be careful not to neglect what's going on inside our bodies.
Exactly.
Because we age both on the outside, which is what we see, but we age on the inside, which is what we see, but it's also how we feel. So modern science has learned a lot in the past few decades. And I'd like to talk a little bit about HRT, which is hormone replacement therapy.
There is a huge demand, and I feel like most of our patients needs it. I would say 80%.
I think that's probably correct, and maybe even higher. What are hormones? People have heard of them, but they don't really know what they are and how profoundly they affect us. So without getting too technical, let me just say hormones are powerful, powerful chemicals that your body produces. And they have an initiation point, which is usually a kind of gland. And then they have a target organ, which is the organ affected by the particular hormones. Now, most of us know the common ones, such as estrogen, progesterone,
Correct.
in a male and female, by the way, testosterone, and I'll get into that a little bit. And of course, thyroid is probably the most commonly replaced hormone. Now, our hormones affect us in a number of ways, but without being too scientific, what they really do is they bring us from childhood to adulthood through our adolescence. And they begin to act on the target organs, which is our muscles, our hair, our skin, our psyche, our ability to have a positive outlook, our energy level, our ability to sleep properly. All these are modulated by hormones. Our hormone levels increase as we go through adolescence, and then we blossom into young adulthood. And then we know how great we look and feel when we're in our 20s. But we also know when we get to our 40s, something begins to happen. As we age, our hormone levels begin to drop. And what we've learned is when our hormones drop, we not only don't look the same, we don't feel the same.
Oh God, yes, doctor. Um, I am 48 years old.
No.
Damn, I said that. I'm 48 years old, and we have patients. They say, "Emilio, you look good," and but when I age, each year, I notice that my body it feels tired. The energy level on my body, it shows that it dropped, and every year that I age, I notice it more and more. So, to be honest, at the beginning, I felt that I had depression. And so we did a hormone replacement, and they said your hormones are not even close. It's very unbalanced. So we did a hormone replacement, and the result after 2 weeks, it was day and night difference.
Absolutely predictable. What we found over the years is we can replace hormones, we can enhance the hormones that you have, and we could have a huge effect on how you look and how you feel. The issue most important to remember is everything has to remain in balance. Hormones have side effects, just as they have good effects. if they're not used properly, they have bad effects, and some of them can be quite bad. That's
Can you
why,
tell us an example?
well, if you overuse, let's say the simplest one, thyroid hormone, if you have too much, you can feel frantic. Your heart rate can start going up. That is not going to happen if the person who's giving you your hormones gives them in a responsible way, using the lowest possible doses, and then most importantly, monitoring how you're doing by taking your blood tests at a good interval and making sure you get all your routine checkups, mammographies, pap smears, and things like that, annual blood work. So if hormones are used properly and they're monitored properly, they can have a dramatic effect on how you look and feel.
Definitely. Definitely. I notice it very well. And in my skin, my hair growth, nail, and energy level, I'm not tired. I can sleep a lot better. And it was like a curtain. They removed it from my eyes. That's how.
You're saying it exactly as we're finding it. As we hit, let's start with women because the changes are more dramatic initially, and that's simply because women have babies. So you have a complex hormonal mechanism to promote and protect your pregnancy. When you reach the age where you're no longer going to be pregnant, nature decides, well, she's done her job. Now we can start letting go of the mechanisms that promoted the ability to have a healthy baby. So, what do we see as a woman approaches menopause? I will get into the men later, but you get something called brain fog. You don't feel as crisp mentally. You start finding yourself becoming irritable. You get insomnia. Those are the ways you feel, including fatigued, lack of a sex drive or diminished sex drive. But you also have physical changes. Your hair, your skin, your nails loses its glow. You lose the elasticity in your skin. When you pinch and it doesn't come back to normal the way it used to when you let go of the pinch. And then, of course, you get fat deposits where you really don't want them. That's around your waist and on your buttocks. A lot of this is attributable to the loss of the hormones that supported the way you looked and felt. Typically, we can easily replace and monitor estrogen, progesterone, and testosterone and thyroid. And if we keep those at a level more consistent with the way you were, let's say, in your late 20s, we can then delay some of the inevitable changes. And as I said previously, and I can't stress enough, it has to be done with careful monitoring and never use a higher dose than is necessary to achieve our goals.
So it's important to choose a correct or good provider.
Oh, absolutely. One who has experience, one who listens to you, and one who's more interested in getting you to the place you want to be than following a set of rules which may not apply in each individual case. We're all a little different and we all deserve personalized care. But it begins with a good understanding of what is concerning you, measuring your blood tests, getting your other tests such as pap smears, mammographies, to make sure
Right.
that the baseline is created so that when we initiate the treatment, we have access to all the studies that we can monitor to make sure your progress is desired and done safely. And it's all doable. And I must congratulate Setiba because I think we're doing it correctly and we're getting great results.
We are. All the patients are happy and the providers are doing amazing job. As you mentioned, listening to the patients, doing a great consultation and follow up and check up their blood work like after 4 months. We revisit our patients for the hormone replacement.
Exactly. And then if the patient calls, we respond quickly to their phone calls because no matter how right you do things, each individual has their own predictable and unpredictable results. But if you respond quickly and you adjust when necessary, then you get what we call an optimum result. Another thing I want to mention is bioidentical.
Yes.
Now, that word is familiar to some people, certainly to practitioners, but not to others. Science is pretty good. We can mimic and recreate a lot of the chemicals that our body produces, such as thyroid hormone, cortisol, and hormones such as estrogen and progesterone. Problem is, we can make them, but they're not identical to the ones our body makes. Medical science, probably through the 50s and 60s, was promoting a lot of non-identical hormone replacement. And I believe, as do a lot of others, many of the problems that became associated with hormone replacement were because we weren't using bioidentical hormones and we weren't delivering them the way nature intended, which is directly into the bloodstream, either by a topical cream, which is absorbed into the blood, injection, or by pellets, which we can insert under the skin, and then they are engineered to release the bioidentical hormone into your bloodstream. And bioidentical simply means if you look at it chemically, it's exactly the same as the hormones our body produces. I remember years ago when I was first in medicine, we used horse estrogen to replace human estrogen.
Really?
Think about that. We're putting horse estrogen into human beings, and the progesterone replacement wasn't progesterone. It was a progestin, which was manufactured in a lab and was different from our natural progesterone. The other thing is it was taken in pill form, which meant it was digested, chemically changed as part of digestion, and then absorbed into the bloodstream in an altered manner. So we believe a lot of the negative effects of early hormone replacement was the delivery system and the fact we weren't using naturally occurring or creations that are exactly the same as our own natural hormones. We've learned a lot since that time, and of course, we only use bioidentical products.
That is amazing. All right, doctor. So tell us how important hormone replacement is for male.
Well, I'm glad you brought that up because it is. Men age differently than women, but we do age on the inside, just the way women do. We age on the outside, but it's a little different in timing and what we see. Eventually, we all wind up in the same place, which is something we want to avoid or push back as much as we can. So what do we do for men? Testosterone is the key male hormone. And of course, as in a woman, with your estrogen and progesterone and your testosterone, it begins to go down in concentration, by our late 30s, early 40s. And it accelerates into our 50s. And what happens? We get flabby, we lose energy, we get a diminished sex drive, we lose strength, we have less vitality. And there's also changes in our hair and skin. And our strength, our muscle strength begins to diminish. We can safely replace testosterone by injection or by pellet. You cannot take testosterone by mouth because your body will digest it in your stomach and you won't get it. And in fact, there can be some dangerous side effects attempting to do that. The principles are the same, however. We measure the levels, we monitor it carefully, we watch for side effects, and we use the lowest possible dose to get the effects we want. And in that way, we can say it's the same as replacing the female hormones. We also have to look at thyroid. That's overlooked. Now, there's some controversy here. The medical purists measure your thyroid, and if it falls within a certain range, we say it's normal. But we know that the way we measure thyroid, we can get a normal result, but we're not getting optimum use of our thyroid hormone where it counts, which is in our cells. Let's back up a minute because this is kind of interesting. You can think of the human body as a living automobile.
Okay.
The wheels are your legs. Your engine in your car is reproduced except at the cellular level. Every cell in your body has a little engine in it, and it does just what the engine in your car does. It burns your fuel. What goes into a car? Gasoline. What goes into your engine in your cells is glucose. You go, glucose? That's the only thing your body burns. No matter what you eat, it cannot be utilized for energy until it's metabolized to glucose. So we take the glucose, it's in the cell, and it goes into the cellular engine where it's metabolized to water,
Mm-hmm.
carbon dioxide, and heat. Give me your hand. Okay? Now touch something inert. Now give me your hand. I'm warm. You're warm,
Yes.
right? Where does that come from? That warmth comes from burning sugar, just like your engine gets hot when you burn gasoline. But it does something else. When you burn gasoline and you put your foot on the accelerator, the car goes forward. The same thing happens. In your cells, when you burn the sugar, you release energy for muscle motion. Without that, we'd flop down. So we burn sugar inside our cells. That's our engine. It releases energy, it releases heat, and it expels carbon dioxide, which we exhale, and water, which comes out in the urine and through perspiration. Where am I going with this? Your thyroid is your accelerator. When you press down on the accelerator, your car goes faster. Your thyroid hormone determines the rate that you can burn your sugar in your little engines. So if you have too much thyroid, you're burning it too fast. If you have too little thyroid, you're tired. So what we've learned is if we measure the thyroid and we only go by what we consider range of normal, we might be overlooking the fact that your thyroid may be normal, but your ability to utilize it in the cells is not normal. So there's a whole school of thought that you replace the thyroid when it's at the lower end of normal when you have symptoms. What are the symptoms? Fatigue, changes in the appearance of your skin, your hair getting brittle. And you can safely replace thyroid. That's an easy one to do because you could take it orally and you can measure it. It's easy to measure. So that's why thyroid is a hormone that we also look at very carefully, and it works in tandem with the other hormones. All the hormones work together. They balance each other out and they pick up the slack where one might fall short. So when you do hormone replacement, it's really important to look at all the hormones because they work together.
Of course. Um, Another question that I have, doctor, some patients that they come to us and they had hormone replacement somewhere else. We work with Biotech, and they said that they did hormone replacement and they gained lots of weight.
That's contradictory. If they're gaining weight and they're taking hormones, something is amiss.
Okay.
So what I would start with in a patient like that is first have them bring in everything or give me a list of what they were taking. And then I compare that to how I would do it and what I would recommend. Then I would make sure I have their updated lab work to see are the levels reflective of what our goals are. Then I would interview them about their diet and their exercise patterns because the patient cannot be a passive participant in their own healthcare. They have to be an active participant. If we're replacing their hormones and we're doing everything we know how to do to monitor them for efficacy, but they're not exercising and they're eating junk food, they're going to get a bad result.
100%.
So we're partners in healthcare. We're partners in their outcomes. So my guess is if a person's gaining weight, somewhere along the litany or the spectrum of things that we're doing for them and they're doing for themselves, there's some gaps. And then we'd analyze it and try to figure it out. But if they're not exercising and they're not eating right, they're going to have a bad result.
It's very important. Same as cosmetics. When we do like treatments for skin tightening, we tell them at home, if you don't take care of your skin, if you don't use aftercare products, you're not going to see as much as result that you should. So if you come for body contouring, we can help you with fat reduction, contour your body. If you don't exercise and not having a healthy diet, the fat's going to come back. So same as hormone replacement. When you get a treatment at home, you need to be on top of it as well. As you said, we are a partner,
You
correct?
couldn't have put it better, and I don't think I could stress that enough. But let me go backwards. Your health begins with what you eat. And if you put junk in, you're going to get a bad outcome. Think of it this way: every cell of your body, your nose, your eyes, your eyebrows, your hair, your skin, your nail, is made of what you've eaten previously. Everything we are is made out of what we put into our bodies. So if you think of it that way, if you build a building and use improper materials, that building's going to collapse the first time there's a high wind. Now, we're not going to collapse, but we're not going to be healthy if we don't start with a proper diet. And there's a lot of good diets. It's easier to know what to avoid. Cake, candy, cookies, fried foods, junk food, things that are filled with artificial ingredients, fillers. Eat organically as much as possible, because the more we know about the chemicals that go on to the non-organic foods, the frightening or the more frightening it becomes when you realize what they're putting on the
Yeah,
food. If that can be avoided, that's the best you can do. It's not always possible. And then there's recommended diets. I like the Mediterranean diet. I think probably has the best outcomes, not exclusively, but what is a Mediterranean diet? Fruits, vegetables, salads, cereals, fish, chicken, olive oil. And people who follow, and nuts, and people who eat the Mediterranean diet tend to have lower cholesterols, better cardiovascular systems, more energy. So that goes hand in hand with the cosmetic enhancements and then the hormone replacements to get optimum health. And then you have to exercise.
definitely. So it's very important to do exercise because it helps mentally and physically.
Absolutely. Not to mention your cardiovascular system, your sense of well being, your sleep patterns. Um, Overall, it's pretty hard to be healthy if you don't exercise. There's something else I want to mention in that regard. There's a lot of different ways to exercise. Some are better than others, but exercising, no matter what you do, is dramatically healthier than not exercising at all. And different people have different exercises that suit them. Find the one that works for you. Taking long walks, can't beat it. It's the most fundamental thing we can do is to walk. A little bit of resistance exercises also enhances your health, keeps your muscle tone. You don't have to be a fanatic about it. I don't mean to use the word fanatic, but I did. Some fanatical things are good because you get an outcome that's very admirable, but it's unnecessary if you just want to be healthy.
Healthy.
There's a difference between being healthy and being in athletic condition. So if you're going to be running marathons, you need to be a lot, not healthier, you need to be in a lot better shape than someone who walks around the block, but you can both be healthy. The person who runs around the block can live a long, healthy life, but can't run marathons. So it's important to do the exercise that suits what your goals and capabilities are. The message I'm really trying to get is make sure exercise is part of your daily routine.
100%. Very important. Very important. So, doctor, with the lifestyle most of people these days have, like stress, running around, not healthy diets, what do you think about IV infusions?
That can really enhance what we're lacking.
Okay.
Our food often doesn't have the vitamins we need. Absorption of the vitamins we take is sometimes inconsistent depending on how well our digestive system works. And we've learned that if you infuse vitamins directly into the bloodstream, you get a much better result. Multivitamins, glutathione, they have very profound effects on a lot of the different functions of your body, and you feel better. You have more energy. So I've been a proponent of this for some time. I remember years ago when I first started in medicine, I'd have patients from Europe, and they would bring me bottles of vitamins from Europe and say, "Can you set up an IV infusion?" We weren't taught that in medical school. It was not in the realm of what we were concerned with. And there's a whole bunch of reasons for that. And I thought, this is really crazy. With the passage of time and more knowledge, I began to see they were a little ahead of us. But now I think we've caught up, and IV vitamins are accepted as treatment really in all kinds of medical settings. Yes, I'm a proponent. I think they work. And I think people who experience that will agree with us.
Definitely. Doctor, you are amazing. Talking about all the treatments, hormones. I don't even have to be here or ask you any question.
No, but you're guiding me and
I
it works.
love
Plus,
it.
you're very knowledgeable too.
Thank you.
So, I was thinking, I get phone calls or inquiries from patients that are interested in hormone replacement as well as aesthetic medicine. But they want to know what the process actually entails. So if I said to you, Amelia, could you review for me and for the audience what a patient can expect when they show up?
Of course. So when you come in, we'll do a good 45 minutes to 1 hour consultation with you to go over your medical history. And then we ask you different questions to make sure you're a good candidate for the hormone replacement. And for sure, on the same day, we do a blood work. We send it to lab. And then when we get the result, we ask the patient to come in, that we can go over their lab results, and based on what we get, we do a palette for them. That we cut a very tiny incisor on the glut, and they insert the pallets, and it takes about 2 to 3 days for the incision to get healed, and it takes about 2 weeks for you to see the results. And then after 6 weeks, we ask you to come back again to make sure everything is okay. In 4 months, we do another lab work.
That's perfect. And I hope people understand that when they come in, they get a consultation. And the
Yes.
consultation is at least 45 minutes. Then there's an analysis of their blood so we could see what the hormones are doing and what the other modalities, such as your anemia, your liver, your kidneys, to make sure that there's nothing lurking under the surface that might require additional attention, even from a different kind of doctor. And once we have established your baseline health, what your hormone levels are, then the preferred method is pellets. Pellets have a lot of advantages over other delivery systems because it's a one-time insertion, it's a pretty painless procedure, and then there is a constant delivery of the hormone into your bloodstream. That said, we still monitor it carefully. So if the patient has any kind of side effects that were unexpected, we're available to explore them, re-examine them. The pellets can be removed just as easily should they not be ideal for a particular patient. That's a rare occurrence, but we're ready to deal with side effects or unexpected effects if they happen. For most people, they don't. It's pretty seamless.
Yeah,
And
they're happy.
they're happy with the results. May I ask you something? If you're willing to share,
Of course.
are you now taking your own hormone treatment?
Oh, 100%. Every 6 weeks, I'm sorry, every 6 months. Every 6 months, I redo my hormone replacement, and there is no way I can stop it, because it made a huge difference in my lifestyle.
That's fantastic.
Yeah,
So
for
you
sure.
would recommend it?
100%.
Living
And
proof.
definitely. And when a patient does it, they come back with their partners. That's
Of
how they see the result, and it's effective.
I think you're living proof. And I
Thank
think
you.
anybody who watches this and looks at you and hears your enthusiasm cannot help but be convinced. And I must say, over years of having the ability to monitor patients, again, if it's done correctly and conscientiously, it really is life altering in a very positive way.
It is. Thank you so much, doctor. I want to
Uh,
ask you a question,
sure.
not related to medical. How do you describe Amelia?
How would I describe you?
Amelia. Yeah.
Enthusiastic, smart as a whip, great looking, and just a pleasure to be around and to work with. Responsible, ethical, and just positive energy.
Thank you.
Those are the things that come to mind initially.
Thank you. Thank you so much. You
So
are amazing, doctor. And I don't say it to everyone. I work with a lot of doctors, but I love you. I love you, and it's my proud to work with you.
I feel exactly the same way. It's a privilege and an honor. I think you
Thank
do
you.
everything the right way. And this is a mutual respect and admiration and love fest. And I'm proud to be a part of it.
Thank you. Thank you. And I would like to invite you for another episode when you have time. I know you're busy, but we would love to have you here. You have you're informative. Whatever, I love it, the way you explain everything. And all of the patients, they need to get educated on all the treatments that we do. Because as you mentioned, we know what are these treatments, but patients, they don't know.
Yeah, communication with a patient is probably the most critical thing when you're in primary care, which I've done my entire career. It starts with asking the questions and listening. You have to know how to listen and you have to know how to respond in a way that the patient understands. A lot of my colleagues, unfortunately, speak down to their patients. They feel that they don't have the ability to understand the technical aspects of medicine, but it's not true. You can explain the technical aspects, but you explain it in language that's
They can
universally
understand.
understood. And that we call the art of medicine. And I'm sad to say it's kind of dying as we rely too much on the mechanics of medicine, computers, data input, lab results, and we lose something in the interaction, the human element. And that is irreplaceable and it's still important in spite of all the technology we have. If you don't communicate, if you don't listen, you're going to miss something and the treatments you prescribe are not going to hit their mark the way you want them to. So yeah, I'm old school in that way.
You said it well. I love that. I love that. And I personally love that. I want to go to someone, they have that mentality.
And I wish we could make it more prevalent. That's another discussion that maybe we'll have next time.
For sure.
But modern medicine is becoming very data driven. And it's a sad fact that the average primary care doctor, that would be your family practitioners, your internists, those who deal on the front line of medicine, now spend more time on the screen than in front of their patients. So I'm going to say that it's not a trend that I think about favorably. And I think there's remedies, but that's a bigger problem and another discussion.
For sure. For sure, we'll do that. So, Dr. Gede, thank you so much for joining us today. And thank you so much for Setiba family who watched us. And please follow us on YouTube, on different platforms that you guys have to listen and watch our podcast. And looking forward to see you guys next week.